Hello everyone, very good evening to all. Welcome back to my channel. Today I am going to discuss about the respiratory system. This is the second unit for the BSc Nursing first years in first semester in the subject of the applied anatomy. So this is applicable for the all the states of the India. So let me start the one by one. So this is the second unit, that is the respiratory system in the subject of the applied anatomy. So let me see the one by one. The respiratory system is responsible for the obtaining oxygen and getting rid of carbon dioxide and aiding in speech production and in sensory orders. From a functional perspective, the respiratory system can be divided into two major areas, the conducting zone and the respiratory zone. So here what I'm saying means, here the respiratory system mainly the responsibility is the exchange of gases between the oxygen and carbon dioxide. We will inhale the oxygen and we will exhale the carbon. There is a exchange of gases between the oxygen and carbon dioxide takes place in the lungs of the respiratory system. Not only that one, again, one more action is there, that is a speech production. It aiding in speech production and also in sensing odors. Okay, so this respiratory system mainly divided into two major areas. First one is a conducting zone and second one is a respiratory zone. So why we have to study? So why this subject is added in the BS nursing first years means, first we will study the anatomy and physiology. So when you're taking the history, so when you're collecting the history from the patient, if you know the anatomy easily, we can find out the abnormalities of the human abnormalities of the structure of the human being. So that is the reason, first of all, we should know about anatomy as well as the physiology. If you know, easily we can identify the deviation, easily we can identify the abnormalities in the structure of the human beings. So that is the reason we have to study the anatomy as well as the physiology of the human beings. Okay, so today I am going to discuss about the respiratory system. Already here they have given no. So this respiratory system mainly divided into two major areas. The first one is the conductive zone and second one is the respiratory zone. So this is the introduction. Body cell continually use oxygen for the metabolic reactions that release energy from the nutrient molecules and produce ATP. At the same time, these reactions release carbon dioxide. So here our body is made up of with the cells. Okay, cells will be there now. These cells continuously they need the oxygen. Okay, our body cells continually use the oxygen. Why they need oxygen? For the metabolic reactions. These metabolic reactions release the energy. Where they are releasing from the energy, from their releasing the energy from the nutrient molecules, and not only this one, they will also produce the ATP, adenosine triphosphate. At the same time, these reactions release the carbon dioxide. These metabolic reactions release the energy from the nutrient molecules and produce ATP. And one more is the it will also release the carbon dioxide. So this system also participate in regulating blood pH. So this system helps to contribute to hemostasis by providing for the exchange of gases, oxygen and carbon dioxide between air and blood and tissue cells. So this is the main function of the respiratory system. So here what is a hemostasis will be takes place in the air, blood, okay, and tissues. Okay, hemostasis will be takes place, and one more is here that they providing the exchange of gases between oxygen and carbon dioxide. So where it will takes place, especially in the air, blood and tissue cells. Okay, the respiratory system parts can be classified according to their either structure or function. Okay, the respiratory system mainly classified according to their structure and according to their function. So if you see the structure, structurally the respiratory system consists of two parts, upper respiratory system and lower respiratory system. Upper respiratory system, nose, nasal cavity, pharynx and associated structures. Okay, upper. Okay, okay, next one is the lower respiratory system. The lower respiratory system consists of the larynx, trachea, bronchi and lungs. Okay, so this is the mainly the respiratory system can be classified according to structure and according to function. Okay, according to structure, two types, upper and lower. Okay, next one, if you see the functional. So functionally, already structurally upper and lower will be there. If you see according to structure function, the respiratory system consists of the two parts, conducting zone and respiratory zone. Okay, once again I'm revising the respiratory system mainly classified according to structure, according to function. If you'll see the according to structure, there may be upper respiratory and lower respiratory. Okay, again next we are going to the, if you'll see the function according to function, so again it's also consists of the two parts, conducting zone and respiratory zone. If you'll see the conducting zone, again it's consists of nose, nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, and the terminal bronchioles. If you see the respiratory zone, respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. So next coming to the branch of medicine. Okay, the branch of medicine mainly deals with the diagnosis and treatment of disease of ear, nose, throat is called auto. Okay, otorhinol otorhinolaryngology. Okay, the branch of medicine mainly deals with not only diagnosis, they will diagnose and again they will give the treatment of the disease of the ear, ENT, ear, nose, throat. Okay, who will diagnose? Okay, who will diagnose and treat the condition of the disease of the ear, nose, throat? So we are calling as a like a so who will like study about the, okay, sorry, not doctor. Okay, otorhinolaryngology. Next, pulmonologist is a specialist in the diagnosis and treatment of diseases of the lungs. Okay, in a pulmonologist, gist is nothing but the, if any word it will come at the end of the gist, we are calling as a specialist. In specialist, in where the he is having the specialization, a specialist in the diagnosis and treatment of the disease of the lungs. Okay, mainly you have to remind ma, respiratory system according to function, according to structure. Structure two types, function in two ways. Okay, next coming to the nose. If you see the nose, it is divided into external portion and internal portion called nasal cavity. Okay, external portion, it will start with the external portion, it will end in the internal portion is called nasal cavity. External nose in the portion of the nose visible on the face. Okay, it will visible to everyone on the face. Consists of bone, hyaline cartilage covered by muscle, skin, and lined by mucous membrane. Okay, on the under surface of the external nose are two openings will be there. So those are called as external nares or nostrils. So here some, okay. Okay, next inferior structure of the, sorry, interior structure of the external nose have three functions: warming, moisturing, and filtering. So here you have to keep it in mind. Okay, so this is the nostrils. So these are the nostrils. Two openings will be there in both sides of the nose. Okay, nostrils or nares, external nares. Okay, the interior structure of the external nose will have the three functions. It will provide the warming, it will providing the moistening, and it will also filter the, okay, air. So three functions will be run by the interior structure of the external nose. You have to keep it in mind. Okay, dorsum, root of the nose, nose bridge, okay, wings of the nose, it is also called ala, tip of the nose, next nostrils, nasal bones, nasal septal cartilage, lateral cartilage, lesser alar cartilage, major alar cartilage. Next, coming to the next part, nasal cavity. It is a deep hollow cavity stretching from over the hard palate at the back to between the eye sockets. It is divided into two almost symmetrical halls by the nasal septum. Symmetrical means same will be there. How your hands will be same, no? The same thing, it will be similar. Same means we are calling as symmetrical. Okay, nasal cavity is a deep hollow cavity. Okay. Okay, deep hollow cavity stretching from over the hard palate at the back to between the eye sockets. It is divided into two almost symmetrical halls by the nasal septum. So here will be there no nasal cavity. So I will show the nasal cavity. So this is the nasal cavity. Okay, cavity will be there no nasal cavity. Nasal bone, perpendicular plate of ethmoid bone, septal cartilage, lower nasal cartilage, frontal sinuses, vomer, plantar bone, maxilla, everything will be there. Okay, so here Openings of the nasal cavity. Nostrils opening from the exterior into the nasal cavity contains air. Okay, the nostrils opening from the exterior into the nasal cavity contains air. Posterior nares opening from the nasal cavity into the pharynx. It will opening into the pharynx. Okay, paranasal sinuses are cavities in the bone forming the nasal cavity which contain air. The main sinuses are maxillary sinuses, frontal and sphenoidal sinuses, and ethmoidal sinuses will be there. You have to keep it in mind what are the sinuses will be there in the nasal cavity, part of the nasal cavity. You have to keep it in mind maxillary, frontal, sphenoidal, and ethmoidal sinuses. There are the four types of sinuses will be there in the part of the nasal cavity of the four paranasal sinuses. Okay. Nasolacrimal ducts extend from the lateral walls of the nose to the conjunctival sacs of the eyes. They drain tears from the eyes. Okay. Nasolacrimal ducts, it will extend from the lateral walls of the nose to the conjunctival sac of the eyes. So what is the main? This will ducts will produce the uh, okay. It will having the okay, tears no, it will automatically they drain the tears from the eyes. Next part is the pharynx. Pharynx, it is also called. It will be located at the throat. It is 12 to 14 centimeters long. Tube lies behind nasal and mouth cavities and larynx. It belongs to both respiratory and digestive system. Okay, so during swallowing, epiglottis covers the entrance to the larynx completely at rest, and during breathing, epiglottis stand up and esophagus is closed, swallowing or allowing air to pass into the respiratory tract. Okay, so this is the one. If you see the structure, easily we can identify the anatomy of the respiratory system of the pharynx. Okay, olfactory mucosa, concha, nasal mucosa, vestibule, hard palate, soft palate will be there, no? Oral cavity, head bone, epiglottis, larynx, pharynx. Okay, the pharynx is here. So where is the pharynx will be there? Okay, here the will be there. Okay, pharynx. It will start from like this. Okay. Okay, this pharynx is divided into three parts: naso, oro, nasopharynx. Nasopharynx. Okay, pharynx is divided into how many parts? Three parts. First one is nasopharynx, oropharynx, laryngopharynx. Nasopharynx, it is lies behind the nose. Okay. Nasopharynx is lies behind the nose. Late structure is pharyngeal tympanic tube. Posteriorly structures a pharyngeal tonsils. Adenoids will be there. Behind the nose will be there. Okay, always the nasopharynx will lies behind the nose. Oropharynx lies behind the mouth. Laryngopharynx is extend from oropharynx above and continues as esophagus below. So, what are the functions of the pharynx? It acts as a passageway for both air and food. It is useful in warming and humidifying the air. Okay, pharyngeotympanic tube plays an important role in hearing. Okay, so mainly it will role playing in hearing, warming, humidifying, passageway for air and food. Okay, next pharyngeal laryngeal tonsils produce antibodies in response to antigen. Next, coming to the larynx. The larynx, it is also called as a voice box, lies in the neck, anterior to esophagus. At puberty, it grows larger in males. Prominence of the Adam's apple. Okay, you have to keep it in mind, ma. So larynx, it is also called as a voice box. Okay, automatically at the time of the puberty in the males, okay, it will grows larger. Okay, so in the development of the secondary sexual characteristics of that time, so they make it a little bit voice changes will be there. Okay, at the puberty, the larynx grows larger in males. It is okay. Prominence of the Adam's apple. Okay, and deeper voice. Larynx consists of the cartilages connected by the ligaments and skeletal muscles. This is okay. So this is the anterior view. So this is a sagittal view. Larynx. It is connected to hyoid bone with the help of the connective tissue. Okay, the cartilage, thyroid cartilage, There are the three types of cartilages will be the thyroid cartilage, okay, cricoid cartilage, and epiglottis. Okay, the thyroid cartilage consisting of the two flat pieces of the hyaline cartilage. Epiglottis is a elastic plate of cartilage. Cricoid cartilage is consist of the hyaline cartilage. Atrenoid cartilage is two in number influence position. Okay. So what are the main functions of the larynx? The larynx helps in production of the sound. Okay, fridge of the voice depends upon the length and tension of the vocal cords. Volume or loudness of the voice depends upon the force with which the cord vibrate. It is a passageway for air between the pharynx and trachea. It protects the lower respiratory tract during the swallowing. So the main functions of the larynx is it will helps in production of the sound. That is the reason we are calling as a voice box. Okay. Okay, always it will depends upon the tension and length of the vocal cords. Next coming to the trachea. So trachea it is also called as a okay windpipe. It is a tubular passage of air. It is about 12 centimeters and long 2.5 centimeters in diameter. Located at the anterior to esophagus, extend from larynx to fifth thoracic vertebrae, where it is divided into right and left bronchi. See here like this tracheal cartilage. It is divided into right and left bronchi. It is extended from the larynx to fifth thoracic vertebrae. Okay, from here to here it will extend like this. The trachea is having four layers: mucosa, submucosa, hyaline cartilage, adventitia. Okay, so there are the mainly four layers covering the trachea. It's mainly composed of areolar connective tissue. The trachea is consisting of the 16 to 20 incomplete rings of the hyaline cartilage, resemble letter C. Okay, consisting of the 16 to 20 incomplete rings of the hyaline cartilage, resemble letter C. Mainly, this trachea is lined by the mucous membrane containing numerous mucus secreting globulate cells. Next, coming to the bronchi. Okay, the trachea divides into right and left primary bronchus with goes to lungs. See here. So this is the larynx. This is the trachea. Next, coming to the bronchi. Bronchi. These are the alveoli. Okay. Pharynx, larynx, trachea, bronchus. So this is the bronchus. This is the bronchioles. Okay. Trachea divided into left and right primary bronchus which goes to lungs. Point where trachea divides into left and right primary bronchi an internal ridge called carina. Okay. So where the trachea divides into left and right pulmonary bronchi an internal ridge called carina. Carina or carina is formed. Its mucous membrane is very sensitive and it is trigger the cough reflex. Trachea, primary bronchi, secondary bronchi, and tertiary bronchi, bronchioles and terminal bronchioles, respiratory bronchioles, and alveolar ducts, alveolar sacs, and alveoli. So this is the way the trachea will going on extended to the one part to another part like this. Okay. See here, alveoli, sorry, trachea, okay, bronchus, bronchioles, alveoli, alveoli, okay, fisheries like this will be then see here. Next coming to the lungs. There are the two cone shaped lungs, one lining on each side of the midline in the thoracic cavity. See here. Okay. So these are the lungs. Okay. So there are the two cone shaped lungs, one lying on each side of the midline in thoracic cavity. Apex is rounded, base of the lung is concave and semi-luminar in shape. it will rest on the diaphragm. Medial surface having hilum structures which enter and leave hilum include bronchus, pulmonary artery and pulmonary vein, bronchial artery, bronchial vein, parasympathetic, sympathetic nerves. Area between lungs is mediastinum, where the area between the lungs is called as a mediastinum. It is mainly occupied by the heart, great vessels, trachea, bronchi, esophagus, lymph nodes, lymph vessels and nerves. Right lung divided into three lobes, so that is superior, middle, inferior. Left lung into two lobes, that is inferior, superior. Okay, you have to keep it in mind. Okay, the right lung, left, right. Right lung will divide into three portions. Okay, three lobes. Right lung. Okay, right lung, right superior, inferior, and medial or middle. But whereas in left lung divided into two lobes, anterior, so inferior, superior. See here. So this is the left lung. Left lung, superior, inferior. So whereas in right lung, inferior, middle, superior. Okay, like this it will divide. Okay, air in the alveoli is separated from the blood in the pulmonary capillaries by a wall called a respiratory membrane, which consists of alveolar wall and capillary wall. Lungs are enveloped by the pleura. Okay, always the lungs will be covered by the layer. It is nothing but the pleura, which has two layers. Parietal pleura, it is also known as superficial layer, and visceral pleura. So it will be deep inside the layer. Super, okay. The covering layer of the lungs, it is called as the pleura. The pleura has the two layers. Pleura will be cover the lungs. Mainly it has two layers. First one is the parietal pleura, second one is the visceral pleura. Parietal means only superficially it will cover the lungs of the respiratory system. So whereas in visceral pleura it will deep inside the layers of the lungs. Okay. This space is filled with approximately 2 ml of serous lubricating fluid called pleural fluid. Okay. How much amount of fluid will be there? Okay. Minimum 2 ml of serous lubricating fluid called as a pleural fluid. Okay. Lungs receive blood via two sets of arteries, that is pulmonary artery and bronchial arteries. Oxygenated blood to the heart occur by four pulmonary veins, which drains into left atrium heart. Okay, so let me see the mechanism of respiration, how the mechanism will be takes place in the lungs of the respiratory system. Okay, uponia means rhythmic breathing at rest. Rhythmic breathing will be there when we are in resting period. It consists of the inspiration and expiration. Inspiration means what? It is an active process during the which size of the thoracic cavity is increased by the contraction of the appropriate muscles. Parietal pleura follows the expanding chest wall. Expansion of the lung is associated with a fall in the pressure in the lung parenchyma and atmospheric pressure air. Okay, inspiration means it's active process. The size of the thoracic cavity is increased by the contraction of the appropriate muscles. Automatically, so when they are, it will follow the expanding the chest wall. Expiration, it is a passive process. Okay, whereas inspiration is active process. Okay, but expression is a passive process. At the end of the inspiration, the muscle which contracts actively during the inspiration relaxes and elastic recoil of thoracic wall. Lungs cause passive expiration. Okay, rib movements, diaphragmatic movements, accessory muscles of inspiration. So there are the three action will be takes place in the mechanism of the inspiration. Okay, rib movements, diaphragmatic movements, accessory muscle of the inspiration, and one more is the contraction of the anterior abdominal wall muscles, internal intercostal muscles, accessory muscles of the expiration will be takes place. Okay, so not only this one, according to one more author, I will give the structure of the organs of the respiratory system. Okay, so here what is respiratory system? Respiratory system, if you want, you can go through this one also. I will give you two types of the notes. According to your convenient way, you can follow ma. Respiratory system also, respiratory apparatus, ventral system is a biological system. Okay, it's a biological system, okay, consisting of the specific organs of the structures and used for gas exchange in humans. Okay, respiratory system, it's a biological system. It's mainly consists of specific organs. These organs and structures mainly used for the exchange of gases in human. That you have to keep it in mind. What is the main action of the respiratory system? It will take place the gas exchanges in humans. Okay, organs of the respiratory system: nose, nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, two lungs will be there. Okay, so this is the like a blueprint of the nasal cavity or nose. Here, mainly two cavities of the nasal cavity divided by the septum. Anteriorly insist hyaline cartilage. The roof is formed by the ethmoid bone. Floor is formed by the roof of the mouth. Medial wall formed by the septum. Lateral wall formed by the maxilla. Shortcut notes. If you want, you can follow this one. So, what is the what about the pharynx? Pharynx is the part of the throat. It is behind the mouth and nasal cavity and above the esophagus and the larynx. The length of the pharynx is the 12 to 14 centimeter, extended from the base of the skull to the level of the 66th cervical vertebrae position, superiorly, inferiorly, anteriorly, posteriorly. How the pharynx will be located in the respiratory system. Okay, so this is the structure of the nasal cavity. See here. So zone, pharynx, epiglottis, larynx, pharynx, esophagus, and everything. Okay, so here the pharynx is divided into three parts: nasopharynx, oropharynx, laryngopharynx. Nasopharynx behind the nose, oropharynx behind the mouth, laryngopharynx extend from the oropharynx. See here. Okay, behind the nose, behind the mouth, extend from the oropharynx. Okay, this is, see here. The nasal pharynx is mainly divided into three portions. No, nasopharynx, nasopharynx. See here, starting behind the nose, behind the nose, nasopharynx, behind the mouth, oropharynx, extended from the mouth, hypopharynx, or oro laryngo, sorry, laryngopharynx. Okay. So next, the pharynx is composed of three layers: mucous membrane, fibrous tissue, smooth muscles. So where the pharynx is getting the blood supply: facial artery, facial vein, interjugular veins. So where they are getting the nerve supply: vagus nerve, glossopharyngeal nerve. So these are functions of the pharynx. Okay, passageway for air and food, warming, humidifying. Okay, taste, hearing, protection, speech. So these are main functions done by the pharynx. Next, coming to the larynx. Larynx, it is also called as a voice box. It's extended from the root of the tongue. It lies in front of the laryngopharynx at the level of third, fourth, fifth, sixth circular vertebrae. So already I told no. So with the time of puberty in the males, it will going on extend the size of the pharynx. Sorry, larynx. It is just like a difference in the size of the, okay, Adam's apple we are calling at the time of puberty in the males. Superiorly, inferiorly, anterior, posterior, how it is located. See here, epiglottis, vocal cords, trachea. Okay, structure. The larynx is mainly composed of several irregular shaped cartilages attached to each other by ligaments and membranes. Okay, main the larynx is voice box. We call now voice box. Okay, main three cartilages will be the thyroid cartilage, cricoid cartilage, adenoid cartilage, epiglottis. Okay, this one. Thyroid cartilage, cricoid cartilage, adenoid cartilage, epiglottis. Functions of the larynx: production of sound, speech, protection of the lower respiratory tract during swallowing, passageway for air, humidifying, filtering, warming. Next, coming to trachea. Trachea, it is also called as a windpipe. It's a continuation of the larynx and extend downwards to above the level of the thoracic fifth, where it is divided into right and left pulmonary bronchi. 10 to 11 centimeters. Relation. See how it will be location: superior, inferior, anterior, posterior, and lateral. See here, superiorly the larynx, inferiorly right and left bronchi, anteriorly upper part of the thyroid gland, posteriorly the esophagus, laterally lungs. Composed of three layers: fibrous elastic tissue, smooth muscle, ciliated columnar epithelium. Okay, blood supply, vagus supply, venous nerve supply, where they are getting. Functions: cough reflex, warming, humidifying, filtering. Next, bronchi and bronchioles. There are two bronchi when the trachea is divided into about the level of thoracic vertebra 5. The right bronchus have the three parts, three lobes, superior, inferior, middle. It's a wider, shorter, and more vertical than the left bronchus, length 2.5 centimeters. Okay, this right bronchus have the three branches, one to each. Left bronchus narrower than the right. It have only two lobes, that is the inferior, superior. That's it. See here the lung, parts of the lung of the bronchi. Next, coming to breathing. How the breathing will take place in the respiratory system. Breathing supplies oxygen to the alveoli and eliminates carbon dioxide. Muscles of breathing. Expansion of the chest during inspiration occurs as a result of the muscular activity and partially voluntary and partially involuntary. The main muscles used in normal quiet breathing are in the intercostal muscles and diaphragm. So these are two main muscles are responsible in the breathing of the uh, respiratory system. Okay, intercostal muscles, diaphragmatic muscles. During difficult or deep breathing, they are assisted by the muscles of the neck, shoulders, and abdomen also. Intercostal muscle, there are the 11 pairs of intercostal muscles that occupy the space between the 12th pair of the ribs. They are arranged in two layers: external and internal intercostal muscles. The first rib is fixed. Okay. Always they pull the other ribs towards the first rib because the shape and size of the ribs they move upwards when they pull upwards, enlarging the thoracic cavity. See here, intercostal muscles, external intercostal muscles. Next, diaphragm. Diaphragm is a dome-shaped muscular structure separating the thoracic and abdominal. It will separate. Okay, it will separate the thoracic in upper portion, lower portion abdomen. It will separating the structure of the thoracic and abdominal cavities by the diaphragm. It forms the floor of thoracic cavity, and the roof of the abdominal cavity consists of the central tendon, which muscle fibers radiate to be attached to the lower ribs and sternum and to the vertebral column by two crura. See here. So this is the sternum. Okay. So this is the diaphragm. Left dome. Okay. Right dome. Intercostal muscles and diaphragm contract simultaneously, enlarging thoracic cavity in all directions. Cycle of breathing. The average pulmonary respiratory rate is 12 to 15 breaths per minute. The average breath of the respiratory system is the 12 to 15 breaths per minute. Each breath consists of three phases: inspiration, expiration, pass. Okay, that you have to keep it in mind. Inspiration, expiration, pass. 12 to 15 breaths per minute. This is the average respiration. Okay, inspiration lasts about 2 seconds. Okay, next coming to the lung volumes and capacities. Respiratory cycles 15 per minute. Tidal volume. This is the amount of air passing into and out of the lungs during each cycle of the breathing. About 500 ml is tidal volume. Exchange of gases. Inhaled oxygen enters the lungs and reaches the alveoli. The layers of the cells lining to alveoli and surrounding capillaries are each only one cell thick and are in very close contact with each other. Oxygen passes quickly through the air and blood barrier into the blood in the capillaries. Similarly, carbon dioxide passes from the blood into the alveoli and then exhale. Okay, diffusion of oxygen carbon dioxide depends upon the pressure differences. Okay. Okay, so a little bit I have summarized the structure of the organs of the respiratory system for the BS nursing first year in semester 1 in second unit, that is the respiratory system, in the subject of the applied anatomy. Thank you all for watching my channel. Have a nice day. All the best. Bye bye. See you in next video.